Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish Retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish Retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and in this episode is everything you need to know about creating intimacy in your relationship after you've had the kids. So before I get into it, I want to make a few things very clear. Of course, as always, not giving any type of medical advice. If you have any questions about your health or anything else for that matter, please speak with your friendly neighborhood healthcare provider, and definitely no advice on religion is being given. So if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So on with me today, I'm super excited to have on with me Dr. Jessica Chacko, and Dr. Chacko is coming to us from Florida. So Dr. Chacko, please introduce yourself to the listeners and the viewers out there.
Yes, definitely. My name is Dr. Jessica Chacko, and I am a pediatrician and the founder of Blooming Bright Pediatrics, which is a direct primary care practice here in Lithia, Florida. I'm a pediatrician. I'm also a parenting expert, an obesity medicine specialist, as well as someone who is just very passionate about changing how medicine is done for most of our patients, which many of us in that direct primary care movement are all about. So in direct primary care, you have direct access to your provider through text, calling, email. And the idea is that you don't have to go through multiple layers to get to your doctor, and can answer your questions, which means that as your pediatrician, I can help you with all things related to your kids, including parenting and advocacy and anything else. So that is me, and that is my practice.
Awesome. Amazing. Well, so let's just get right into it. There's a lot of people on here that may have children or, maybe finding it very difficult to create that intimacy between their partner again once they have, a baby. And as we know that once you have children, I think you have a few children yourself, right?
Yes.
How many do you have?
Yes, I have 2 little boys. They are currently just about 3 and newly minted 4. So mine are about 18 months apart. So
yeah.
um,
Yeah. So, you know, as well as I know, that it's so hard to find that time to create intimacy in your relationship with your partner. And so, how do you find, or how do you coach your patients and their, not so much your patients, but really the parents of your patients on creating that intimacy again in their relationship once they have children?
So I think a lot of it depends on where they are at, which basically means how many children they have and how
Mhm.
young that youngest child is.
Yeah.
So for our newborns, when we have a newborn in the house, quite honestly, that first 4 months, as I'm sure we call it the fourth trimester because it's essentially like as if you're just taking care of the baby as the womb of that baby. We are just parents' role is just every moment is consumed with keeping this tiny little baby alive and not crying and hopefully sleeping and hopefully eating. So it really does depend on what stage, and of course, when they're toddlers, we're trying to keep them alive, but in completely different ways, right? We're trying to prevent them from like running off of cliffs and
Yeah.
climbing in the oven that's on and all of these things. So a lot of it depends on where they're at. I think the hardest time to reconnect with our partners in those super early days in that fourth trimester area, because truly parents' lives have just shifted dramatically. Whether it's baby number 1 or baby number 6, it's just a really difficult time. Moms' bodies have changed completely, right? We went from slowly growing this baby inside of us over somewhere between hopefully 7 to 10 months, right? And then within, I don't know, maybe 5 minutes, maybe an hour, suddenly that baby is gone and our body is just a completely different size, shape. We have pain in places we're not used to having pain. And it takes a long time for the body to recover from that.
Yeah.
And then for dads, it's really just a matter of like, okay, where is my role in this new kind of mom baby dyad? We talk about that a lot in our families because moms, if they're breastfeeding, then their health is necessary to keep the baby alive. But then dad is around too, or maybe partner. I shouldn't necessarily say dad, but partner is around. So, we want to find that balance of keeping baby alive, which is super important, um, but also letting parents kind of find their new role and be comfortable enough in that role where they are able to have some vulnerability again that can lead to intimacy. Because if you're not ready to be vulnerable because you're in this fight or flight mode, there is never going to be space for intimacy. So
Yeah.
usually most of my coaching is on parent coaching, and just how to help in that process.
Yeah, definitely. I mean, I think that, when you have a newborn, right? I really feel like those first 3 months are a big blur.
Yes.
Like it just, I don't know. I don't know if you were ever sleeping, but I know that, sleep was rare, and then having to nurse. And then, especially if you have other children, that whole thing, I mean, it's just like a big disaster. I don't know. I found
Yes.
very difficult to connect. And then, you're exhausted, you're tired. And then if you have to go back to work and you're working and then you're taking care of all these little kids, I mean, you really need like a village to help you out. And I think that it's so tough when you don't have anyone to help you out, right? And I mean, I know that like my mom lived out of state, and so I really had very limited amount of people that could help me. I don't have any family here. And so, anyways, I think that it's very difficult for people that have children and then may not have their family around to find that support and to find that help. I think is very difficult.
It's true. And I think, at least here in the US, there's this element of wanting to do it independently, right? And I see this even when we have so much help. It's like, no, 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 I want to feed the baby. No, 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 I want to wash the baby. No, I want to do everything because there's just this drive of, and for some moms, especially if they have an anxiety component, there's this like, no, I have to do it all because it has to be done just perfectly. But, and that happens more in our first babies than in our subsequent babies,
Right,
but
right.
it is something that we see all the time. So, something I often really recommend is for coming up with ways for mom to step back a little bit that she feels
Mm,
comfortable with,
yeah.
and partner, parents, whomever to step in a little bit. Um,
Mhm.
And even if mom is very, very hesitant of it, right? It's still so important. It's important for dads to connect with babies and partners to connect with babies and grandparents to connect with babies. Um, and it's also important for moms to let go a little bit so that they can have some breathing room to maybe get some sleep or maybe take a shower or take a
Yeah.
walk or any of those things that are going to help them like find themselves again, find who they
Yeah.
are again.
Yeah, absolutely. I mean, I think that, oftentimes we get lost, right? Especially as new moms, you barely have any time to like even brush your teeth or wash your face, and you're just so busy, you're trying to figure this out. I mean, I feel like my first one really just rocked my world. It was just crazy. And especially, I mean, that's just becoming a parent in general, but I think that if your child has any special needs or, has any issues where they can't nurse or whatever, developmental issues, then that's, on top of just being a new mom. So I think that that really can be very overwhelming.
Yeah, it can be. In this those first few months, I mean, especially if the mom is choosing to nurse, the whole process of feeding baby can just be like endless. I mean, even kind of with our toddlers, it feels endless, right? There's just they're hungry, and then you finally figure out what to feed them, and they eat, and then they're hungry again. But with our newborns, it's even more. You're trying to latch a baby if you're a new mom, and even if you're not a new mom, all babies have different size mouths, different shapes of the inside of their mouth. And after each pregnancy, the nipple size and shape can be a little bit different. So, just getting the baby to latch can take 15 to 20 minutes. Baby needs to like eat for 15 to 20 minutes on one side, and then we switch sides, and it's another 15 to 20 minutes to latch
Yeah.
them, and then they eat again. And
It's
before
a
we know it,
full day process. I
it's
mean,
a
it's
whole day.
just it's ridiculous. I remember with my first one or my second one, I remember my husband was going off to work in the morning, and then he returned in the evening, and I was still sitting there where I was nursing. He's like, "Oh my God, you haven't moved." And it wasn't that I hadn't moved, it was that I was constantly having to feed and change and burp and then feed. And it was like this never ending, like you're just like, oh my God, your mind goes numb. And then when you finally come across like another adult, you're so happy because you can have a conversation, and you just,
Right.
you can't have that conversation with your little baby. And it's, so those first few months are absolutely very, very difficult. I'm interested in knowing how like pediatricians can help with these type of challenges. Like, what do you suggest?
So, some of them is just really how to like calm down some of that anxiety so that, and also to delegate some of the roles and the jobs so that it's not all on one person, and that we're not constantly stuck in this anxiety mode, right? Like on top of feeding babies, we also like when they're crying, which is for some babies way more often than others, right? And some babies the crying is maybe more constant than the feeding.
Yeah.
um, and how do we calm them down, and how do we get how do we know what they want, and how do we know how to help them? So that's really how I guide parents. So one of my favorite tips, just in kind of delegation of roles, is really once mom has breastfeeding down a little bit, then I love for mom to have dad give at least one bottle of milk per day. One, I think, just in life, right? Life is unpredictable. I've had so many moms end up back in the hospital ICU because of complications after pregnancy. I hope that doesn't happen to anyone, but it does happen on occasion. There's also times where we have an emergency and have to go take care of family far away, and we just can't bring baby with us, right? So it's important for baby to know how to use a bottle. And once we've gotten the hang of breastfeeding well enough, it's not really a big problem to switch from breast to bottle if it's only once a day. So I definitely encourage dads to feed once a day. So once the baby has gotten that breastfeeding down, that does help dads really connect, right? They also get a sense of how hard it can be sometimes, and they just get to take on that role, and then mom gets to let go a little bit, and practice letting go a little bit, because that can be hard for a lot of moms.
Oh, no, I was just gonna say, I remember a time when, like, with my middle son, I was at a party and, he was, like, 9 months old, and he was this chunky little baby, and I don't know, I wouldn't give him to anybody house because I felt like I needed to be with him all the time. So yeah, I mean, I totally understand. I was afraid that somebody was going to like drop him or do something, and I felt like I just needed to hang on to him like the whole time.
Exactly. Exactly,
And
that's so common. So this is good practice for moms and dads.
yeah,
Um, and then the other thing I really recommend is even in that first month or whenever, if we're just exclusively direct breastfeeding, having dad take one of the nighttime feeds, which sounds a little bit weird, but essentially, like, as a mom who has breastfed, it's really easy to fall asleep breastfeeding, right? So we can have dad when it's dad's turn, he goes, picks up baby, he brings them over, change diaper if need to, brings them over to sleeping mom, tells mom, hey, we're gonna latch, mom latches, and then mom gets herself nice and comfy and falls back to sleep. And dad's there on guard, making sure baby and mom are safe. When baby is done eating, or if it happens that baby falls asleep before he or she is done eating, then he can kind of wake them up to help them continue feeding. Once feed is over, he burps them, he changes them again if they need it, puts them back to bed. Um, and that way, mom is essentially sleeping through most of it, right? Which can be a great way for dad to take on some of that nighttime burden. And even if dad is working, because, we think that dad going to work for 8 hours during the day and mom staying home is, mom should be doing all of this. But there's no sleep during the day, even when babies are sleeping. It's just nonstop, as you know. So this can be a way, again, for to let go some of control with mom, because mom needs to practice that. And then for dad to kind of step in. And it also brings the family together, right? And that's where we can want to get mom and dad back to having a good, intimate relationship. Because mom and dad are going to be co-parenting. And it's not that mom is doing all the work and dad is watching mom.
yeah, yeah. I think that's really important. I think that feeding the baby, especially in the early years, well, especially in the early months, right, even
Mhm.
in a few weeks, is really difficult. I think, and definitely having dad participate in that makes a huge difference.
Mhm.
Oftentimes what I say for parents, new parents, really any parents, to create that intimacy in that relationship is to go on walks with each other, right? Like
Mhm.
you can bring the baby in a stroller and you can go on a walk. And so you're spending time together and you still have that baby, but the baby's not like just hanging off of you 24/7, right? The
Yes.
baby's in a stroller and you can still like perhaps, hold hands with your partner or create those moments that are so far and few between, right? If you in between or whatever that saying is, if you and
Few
far
and far
between.
between.
Anyways, but yeah, I mean, just trying to, create those moments with your partner is really difficult, especially when you have a baby and especially one that perhaps maybe crying or colicky all the time. It's really difficult to do that. I think also even cuddling on the couch when you have time or kissing or making a meal together, any one of those things definitely will increase intimacy in a relationship and help out new parents who might think that maybe they need to do something like crazy and fantastic to spark that intimacy between each other, but really it's all about creating the time and being
Yes.
mindful and very intentional about that time.
It is. And, I think I 100% agree with everything you said, finding these little moments to have these connections, right? Whether it's like, an actual kiss, hello, or good morning, as opposed to just like a quick peck where you barely even notice, or, when you have baby in arms, right? And you're hugging, or even like toddler at arm, like, you give an actual hug, in the morning, take that moment to have a good 10-20 second hug and not just the quick little okay see you later kind of thing that we would give to our parents, making those moments and taking those moments to really really connect, um, and to connect with the kids in that same way. I love the walk thing. I'm going to start using that for my parents as well. That's fantastic.
Yeah, just something simple. I feel that, walks are something easy and it's healthy, it's being outside. It kind of checks off all the boxes, right? And
Yeah.
then you can hold hands, you can go in the stroller, you can even involve other kids if you have other children, right? You can all go for like a family walk, maybe if it's after dinner, before dinner, whatever works for you. And and create that intimate moment that, you so badly need and crave. And it's not like somebody, you're having to do something for somebody, right? Everybody's just kind of on this walk and enjoying nature and looking out and stuff like that. So I think that's something that's simple enough to do. And, holding hands, I think, is also really important.
Yeah.
And I feel that, creating meals together, it can be very intimate as well, when both persons are involved, and, and then you get to eat afterwards, right? Which is always very important because everyone has to eat. So I think that doing things like that. What other ways do you tell parents that perhaps they can connect with each other? How can partners help moms?
So I think one of the things that I like for families to remember, I think sometimes again we focus a little bit too much on the moms, and I think moms deserve a lot of focus for sure. But we kind of from the beginning, there's this aspect of dad's kind of like watching from the outside. So it's really important for parents to come to like decisions about the kids together. I see it all the time. Mom's feeding baby all the time, and then it turns into toddlers, and so then mom's disciplining the kids all the time, and dads are kind of like, oh, mom's reading all the books and all of this stuff. And so not necessarily that dads have to do more work, but maybe that moms and dads need to be partners in the decisions about the kids as well. I see all too often, and one of the classic examples in my practice is, moms, in our older kids over the age of 1 year, 1.5 years, co-sleeping is safer, and so a lot of people end up co-sleeping with their toddlers and their elementary school kiddos because they just are too afraid to sleep on their own, which is a normal thing to get into around that age. So kiddo climbs into bed with mom, and then kiddo, I don't know if you've ever slept with a kiddo, but they take up the whole bed. And so then
Yeah,
dad,
they're kicking you in the face with their.
exactly. And then dad ends up getting out of the bed and moving to the couch or the guest room or something, right? And so these are things that we have to discuss, whether it's getting a bigger bed or deciding that kiddo is going to sleep in the other room. But we need to like really talk about these things and how we're going to do it. So it's not just by default, these are the things that happen.
Yeah, absolutely. I mean, I think that happens very common, right? That where the little child will come in. We had that actually all the time with my with my eldest. He would just, throw the door open and walk in. This was
Hmm.
always at like 3 in the morning,
Hmm.
and he would just tap my husband on the shoulder, and then my husband would get up and walk into like the guest room, and then my son would just get into bed, and we kid with him all the time because now he's a freshman in college. But it's just so funny how that time flies. But at the time when you're going through it, it definitely does not fly, and you're like, oh my god, when is this kid
Yeah.
going to get older? So that they stop doing these things. But now in retrospect, you look back and you're like, wow, I kind of miss those days.
Yeah.
So it's
And
funny.
so a solution to that, I mean, doesn't work for every family, but one solution could be just having a bed on the floor for kid, right? So
Yeah.
when if kiddo wants to sleep in the room with you, sure, okay, it's going to happen inevitably, right? So let's make a space for them so we don't have to kick dad out, because how if mom's gonna get to sleep with kiddo, right? Like I have my two toddlers, and they end up in our bed quite frequently, and it's so lovely to snuggle with them sometimes. So
Yeah.
why not let dad have that lovely experience too? So make space for it,
Yeah.
and then that just means that that room on those particular days is not meant for intimacy, but we there's definitely other spaces which can also make it a little bit more exciting, and a little bit give a little bit of spontaneity, right? As opposed to just having routines.
Yeah. I think also something that can, as we're talking about little kids and babies and newborns and things like that, sometimes what happens with a newborn is that when, parents when mom starts to have intercourse again, I think that there can be the first time after a delivery, there can be a lot of pain, and I think that that's really important to understand. And of course, you always want to go for your checkup after delivery, make sure everything looks fine, and
Yes.
that if you've had stitches, to make sure those stitches have healed. But sometimes women can experience a lot of pain, and that can be because you're breastfeeding. So there's a new terminology terminology that you probably heard Dr. Rachel Rubin say is the genitourinary syndrome of lactation.
Mhm.
And what they state is that basically it's kind of the same thing as with menopause, that your estrogen levels go down. You and I both know that estrogen levels have to go down or go down right after a delivery. And that allows the milk to come in the breast and allows that breastfeeding. And so a lot of times women can have pain with intercourse. After they deliver because of that decrease in estrogen. And so one way to resolve that, of course, is, lubricants, but really vaginal estrogen can also help with that to help replenish that tissue and cause decrease with pain, increase lubrication, and, make intercourse not painful for women. So I think that that's something that, isn't really talked about that often. And, but I think that it's something that's very, very important for women to know about. And if they experience pain with intercourse right after delivery, to make sure to go and have that assessed by your gynecologist.
Yeah, I agree. And I'm not sure if this is something that you have heard of, but I have definitely heard of. So I had two C-sections. My first was an emergency C-section, and the second was scheduled. Um, and so for me, the very first time, the actual orgasm itself was a little bit uncomfortable in the uterus area. I felt pulling in ways that I didn't feel before, and not necessarily like painful, but just kind of like, oh, that's different. That's not the body that I remember. So I think there's just so many things, right? And then maybe we have milk leaking, and everything can be so uncomfortable. And if there was a C-section, the belly is uncomfortable, so anything
Yeah.
touching the belly can be really
Yes.
uncomfortable. It's just really, really,
Yeah.
it's really just getting used to your body all over again, which can be hard for someone who's lived in their body for decades, right?
Yes, and that's a really good point that you bring up, because body image is a huge problem for women when they decide to become intimate again with their partners. And, things have changed so much, right? Like, you just gave birth, you've got all these stretch marks, maybe like you said, maybe you're breastfeeding, so you have milk, and maybe you're pain, you have this vaginal dryness and so and then you just you don't have that same body as you did maybe in your 20s, whatever, and you're just like, wow, maybe you're not loving your own body. So I think that that is definitely an issue that comes up for a lot of women. And what ends up happening is that they end up spectating, right? So when they're intimate with their partner, instead of really being in the moment and really thinking about what's going on, instead they're just watching their body and thinking like, wow, maybe they don't like their body. And so then that's a huge turnoff. So, a lot of times women will say that, oh, it's hard to become intimate with their partner once they've had children, or really even in general. And that's because, they are just so critical of themselves and of their own body that they have a hard time really being mindful during the process. So that actually, it can be a big problem.
It can be, it can be. And, that is like a huge topic for so many things. But one of the things I recommend for families, for all of their kids, right? And even when they're newborns, because we hear and understand so much. Our babies understand so much, even when they're like 2 days old, right? Um, but I always encourage our families never ever to talk poorly about their body image in front of their kids, right? And so maybe that means we are never going to say, no, you can't take a picture of me because I look fat today, or because I'm having a
Mhm.
bad hair day, right?
Yeah.
Or no, I look terrible. I look terrible in that. Don't look at me. Or no, I can't go out today because blah, 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 right? We always want to say, oh yeah. And if it's a picture and you're like in your head, you're like, oh my gosh, I've never looked so awful in my entire life. Please don't show that picture to anyone. You still like, oh my gosh, look at us. We look so wonderful, and we look like we are so happy. And you find something positive to say. And what I find is that the parents who take this practice on deliberately, and they come back to me and they're like, I'm doing this for my kids, but I'm starting to see myself differently now. And I'm starting to feel different about my own body. So I feel like that's a practice that we can definitely start in every moment. And my goodness, for our women, our bodies have done this miraculous thing in helping to like hold this baby that was just miraculously like formed. And it's just a miracle in itself. And so to be loving towards our bodies for that.
Yeah, I think that that is super important, to always show compassion to yourself. And I was listening to something today, and they said, that the person that I was listening to, they were saying that, they always ask themselves, what does, Jessica or whoever it was, the person, what do they need today? Right. So asking yourself, what do you need today? And, can we be more, how can we be more compassionate to ourselves, show ourselves kindness? I think that, really showing that compassion and kindness to ourselves is where it starts, right? Because if we're able to show compassion to ourselves, then we're able to show compassion to others and give ourselves. Oftentimes I feel like we just don't give ourselves enough grace, right? And we're always so judgmental and saying like, oh, we're never enough for ourselves, really, truly. And that just understanding where we are in life and knowing that we're meant to be wherever we are in life, and that, that things are going to be okay, I think is really helpful for people.
It is. It is. And that famous saying, and this too shall pass, right? So
Yeah.
whatever the struggle is today, and as with parents, we know this, right? I mean, just as soon as you get comfortable, and even as physicians, right? As soon as you get comfortable in something, something shifts, right? And
Yeah.
and and it's just the way it is. And so whether that shift is, I mean, whether no matter how uncomfortable you are right now in this moment, we're gonna shift out of it.
Yeah, absolutely. Absolutely. And I think that, one way to increase intimacy in a relationship or to really get back into it is definitely sharing household chores, right? We know that the uneven distribution of household chores definitely can decrease libido. And I think a lot of women, once they have children, experience tons of decreased libido. And, it's because they have so many things going on, and intimacy just becomes one more thing on their plate. But, once you start distributing or getting help or whatever it is that you need in your relationship, then I think that that allows more bandwidth for you to be intimate with your partner, right? I think that's one of the things. Another thing is that because we're so preoccupied thinking about family and chores and baby and this and that, is that, that also leads to a decrease in libido. And I think that when you're able to really focus, and Dr. Lori Brado talks about this, she's a psychologist out in British Columbia,
Mhm.
and she always talks about this, is that, she has a book called Better Sex Through Mindfulness. And she talks about how just, and they did this whole study where they use mindfulness in relationships and for women. And what they did is they had a cohort of women that they practiced mindfulness with. There were 90-minute sessions, and they did it for 6 months. And what they noticed is that those women had initially come in for decreased libido. And what they noticed is that these women had increased libido, increased lubrication, increased arousal, and increased satisfaction in their relationship by practicing mindfulness in their relationship, but specifically while they were being intimate, right? So while they were being sexually intimate with their partners, to really just focus on, the five senses, like the taste, the smell, the touch of what they were doing, and just really being present in the moment. And by doing that, that in itself increased libido.
That's amazing. I think that like I want to read that study, so I'm gonna definitely write it down. But
Yeah.
that sounds it's because as a parent, you're like, oh my gosh, are the kids gonna walk in? Or like, is the kid gonna start screaming? Or, did I turn the stove off? Or whatever it is, right? And so then really allowing yourself to be in that moment. That's perfect. And honestly, with our partners, that's what we want, right? That's that intimacy is like we want to be seen, like truly seen, right? And
Yeah.
not just like going through actions to get another job done.
Yeah, absolutely. Absolutely. And I think that, really when we create that mindfulness, it really plays, starts to impact all aspects of our life. And, when we're able to really pull that into our relationship, it's very, very helpful. And of course, it's going to increase that emotional intimacy that we really seek, right? Because I think a lot of times parents, once they have kids, they really feel disconnected with their partner. And so, to create that emotional intimacy, you have to allow yourself to be vulnerable, but also, increasing that mindfulness in your relationship. And when you have those intimate moments, really will continue to create that emotional intimacy, which then, will lead to physical intimacy. I think oftentimes what happens is that, when we have so many things going on in our brain, we can, without even realizing it, we can be just not receptive to a sexual stimuli. So there's this whole thing called the human sexual response cycle, but and I talk about it in my other podcast, but really it's, to be open, to have that increased desire and to allow yourself to experience that arousal really begins with permission, giving yourself permission, right? And I think that because we're women and we're so used to multitasking, and sometimes we don't allow ourselves to experience pleasure, sometimes we don't allow ourselves to really be in the moment. And I think when we give ourselves that permission, then we are open to any type of sexual stimuli that may come our way, which then allows for that arousal to build up, which then leads to desire, which then leads to the emotional intimacy, which then leads to that physical intimacy. And then that circle continues where, you're able to experience that desire. And I did a whole reel on this as well, but it's that we also talk about like responsive and spontaneous desire. And what I think is important for new parents to realize, and also just for any parents or anyone in a long-term relationship, is to realize, or even in somebody that's in a new relationship, is to realize that it's not spontaneous desire. What is Dr. Rosemary Basson actually says. She's the one that came up with the idea of that human sexual response cycle, but she actually states that she doesn't believe there's any such thing as spontaneous desire, and really everything is responsive. And that we have to prime. Responsive means that you have to be open to a sexual stimuli so that you're able to participate. And that even in early relationships, we think that it's spontaneous, but it's really not. It's actually responsive because you've been priming your brain. You've been thinking about going out with your partner all day long. You've been anticipating what you're going to wear, what you're going to eat, how the night is going to end, what you're going to do. And so your brain is primed. So even though you think it's spontaneous, it's not really spontaneous because you've been thinking about it. And really everything is responsive. So I think when people think of like long-term relationships, they're like, oh man, I feel like I got to really, I have to have a date night. I have to do this, I have to do that. But really you've been doing that the whole time that you've been seeing this person. You just didn't realize it.
Yeah, I 100% agree with that. And it's like, when we have a bunch of kids and maybe a bunch of little kids, and maybe date nights are just out of the budget because date night means we need a babysitter, and then we need to have the date night, or whatever the case may be. Maybe there's just no one around that you trust for a babysitter or whatever. We can have these buildups and these spontaneous moments and this like connection in small ways. And so,
Yeah.
as I was mentioning before, with those hugs that are actual hugs and not just
Yeah.
like the kind of obligatory goodbye hug, like give your partner like a real hug. And if the kids are around, so be it. And maybe give them a real kiss, I mean, it doesn't have to go on for 20 minutes, but like maybe 2 minutes, um,
Yeah.
and
Yeah.
not just a peck. Or maybe, one person spontaneously grabs the other person and puts music on their phone or through Google or Alexa and just starts dancing around the kitchen with the kids at the dinner table. There's ways that we can have these connections. And
Yeah.
um,
Yeah.
and maybe it's planning. Our date night is going to be after the kids go to bed on Friday night. We are going to make a gourmet meal, and we're going to have dinner at 10 p.m. instead of 5 p.m. with the kids. Or, there's ways around it. And I
Yeah.
love that idea of the anticipation, because that really does build it up, that makes it last the whole week as opposed to just for that 1 hour or whatever the case
Yeah.
may be.
Yeah. And then, both people get to, and that really actually works also when somebody has low desire and high desire, because when you have a date night or a time that you're actually going to be together and be able to spend that quality time together, that allows a person with the high desire to know that, they're actually going to be able to be intimate with their partner. And the person with the low desire, it gives them time to think and wrap their, head around the idea that they're going to be intimate, right? And so it leads to decreased resentment, decreased anger on the partner that has the high desire, because when they're always approaching the person with the low desire, they're always being rebuffed or told them no, whatever. But now they can finally come to a meeting point where they can both be satisfied. So
Yeah. And that gradual buildup works for both of them, but in different ways. For the one
yeah,
person, it's like a buildup. Okay, this is coming and I'm going to get myself ready for it. And the other person, it kind of, every time they think about it, it kind of acts as like a small dose of intimacy.
yeah. Yeah, absolutely. Absolutely. So it's fantastic. Well, thank you so much for coming on and sharing your tips and talking about how people can, increase intimacy in relationships, especially after newborn. And, when you talk about that kiss, that long kiss, actually the Gottmans, so Gottmans are a couple that talk about relationships and intimacy and things like that. And they actually talk about the six second kiss. So a kiss that
Mhm.
lasts, pretty decent amount of time, that you're not rushing through. It's not like a peck on the cheek or stuff, to increase intimacy in a relationship. So yeah, absolutely. Giving like a real kiss to your partner. Well, thank you so much for coming on. And so for people that have been listening, and they'd love to see you as their doctor for their kids, to have you as their pediatrician, how can they get in touch with you? How can they make an appointment?
So they can find me at bloomingbrightpediatrics.com. It's the website for my practice. I also have a practice. I also have a website just with my name, Dr. Jessica Chacko. And I'm on TikTok and Instagram and Facebook as at Dr. Jessica Chacko.
That's excellent. Well, thank you so much. And is there a pearl that you would like to leave people watching with? What would you like some last parting thoughts?
Yeah, I think, and this is definitely meant as just an inspiration and not another thing to add on to like our parents' guilt, right? But
Right.
um, with our kids, and we are a part of our job as being a parent is showing our kids how to be a partner and how to treat their partner, right? So having that beautiful relationship with your partner is really an important part of parenting.
Absolutely, 100%. You're so right, right? We even times when we think that our kids are not watching, they're absolutely watching. They're watching how you treat each other. They're watching how you respond after you may have had an argument. They can sense a tension in the house. They know all this stuff. So, even when we think that we are being discreet, we're really not because our kids are watching and they know.
They really are. They really
Yeah.
are.
Absolutely. And we're modeling for them, right? Because however we act, however we deal with problems,
Mhm.
and our relationship with our partners, that's probably what they're going to seek out when they get older and look for spouses themselves, right? Or partners or whatever.
Exactly. Exactly. And I would say that just to add on to that, when we do, act less than perfectly with our partners, which we all do, right? Um,
Yeah.
it's really important to explain that to our kids. I was like, oh,
Yeah.
I just yelled at dad and I really didn't mean to, and nobody deserves to be yelled at, but I was just so frustrated and okay, I have to work on that because no one deserves to be yelled at and that kind of a thing, so that they know, oh yeah, mom did yell and I wasn't sure, and it had nothing to do with me, so that's good. And oh right, yeah, nobody deserves to be yelled at, so it's not okay for dad to get yelled at. It's not okay for me to yell at someone, and it's really important to name it when we do something that's less than perfect, because we are all less than perfect. Thank goodness, right?
Yeah. Yeah, I'm glad. I like how you said that. And also, I think it's important to see them, witness you apologizing either to them or to your partner or whatever, so that they know that there's nothing wrong with apologizing to somebody if you've made a mistake. I think that's really important too. It's important to model that. Well, thank you so much, Dr. Jessica Chacko, for coming on and sharing this insightful information and how to create intimacy when you are a new parent and then with newborns or with just children in general. So
Yeah, it was so much fun.
thank you so much. And well, we are done here and it's been real and really intimate. And remember, this is not meant to be any type of religious or medical advice. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.